Good morning. Today is Thursday, July the 9th, and this is our weekly COVID-19 update briefing. Unfortunately, sadly report that as of this morning, Bossier Parish has experienced 1,142 positive cases of the COVID. That's an increase of 236 since last week, and the largest single week increase that we've had. Unfortunately, our deaths have increased to 36 for the parish, which is an increase of 5 since our report last week. I think it would be prudent perhaps this morning and helpful if we review some of the myths and facts with regard to this COVID situation. The information I'm about to provide to you is developed by the Louisiana Department of Health and Hospitals, specifically Dr. Guidry, who is the medical director at Louisiana Health Department. The first myth number one, is that wearing a cloth mask is of no use. The fact is that frequent studies show that wearing a mask does work. The studies indicate that if 80% of Americans wore masks, the infection would plummet. Myth number two, if I'm not sick, I don't need a mask. The fact is it takes several days to show symptoms. And if you have no symptoms, it does not mean you don't have COVID. You can spread it, so wear a mask in public. Myth number three, if I wear a mask, I don't need to social distance or avoid crowds. The fact is, masks are not a silver bullet. They're merely a layer of protection, an additional layer of protection. So again, we should continue to do all three: wear masks, social distance, and avoid congregating. Myth number four, my mask just needs to cover my mouth. Fact, to be effective, mask must cover both your mouth and your nose. Myth number five, antibody tests prove that you can never get COVID again. Dr. Guidry says currently we don't know if that is true or not. Fact number six, people should try to get COVID-19 to build up herd immunity in Louisiana. Fact, Louisiana is nowhere near the minimum herd immunity threshold. Myth number seven, it's not necessary to quarantine for 14 days after your test results. The fact is, testing does not replace quarantining. If tested, you are directed to quarantine for 14 days. And lastly, myth number eight, I don't need to give information to contact tracers if I've already called my family and friends about my positive test results. The fact is that contact tracers notify you of the exposure and connect you to resources and supplies that would be helpful to use. Those are the facts according to, again, Dr. Guidry. When should we wear a mask? Well, the Louisiana Department of Health and Hospitals says mask or face covering should be worn in indoor public spaces and anytime in public when you are near others who are not in your immediate household and when mandated by state or local officials. Everyone, when in public places such as parks, outdoor recreation, shopping areas, social settings of more than 50 people should be avoided when social distancing is not practical. Wearing a face mask or covering is not a substitute for keeping social distance of 6 feet from individuals not in your households. Those with breathing challenges or those under the age of 2 should not wear a mask, I'm told. We may have a coronavirus without showing any symptoms, but if so, we can still infect others. We can spread it to our families, siblings, friends, and you would never know it, but you could possibly infect and cause illnesses and death to many others, even if you don't experience the symptoms. The virus seems to spread most often through personal contact with others. So again, we keep repeating that you just simply should continue to wear the mask in public, continue good personal hygiene, continue the 6 feet or more practical distancing, and the restrictions on facility occupancy. It would be prudent again to review the preventive and mitigation protocols that we've stressed every week, and we will continue to do so. These are the 6 things which we should all do. First, wear face masks in public and mass transit. Wash or sanitize your hands. Sneeze or cough in your elbow. Avoid touching your face. Stay at home when you're sick and follow the guidance from your medical provider. Increase testing in young adults 18 to 29 years of age. Not following prevention and mitigation procedures seems to be the biggest reason for the recent increase. In the briefing yesterday by the governor, it was indicated that approximately 1/3 of the recent new cases are from young adults. And businesses, as we mentioned last week, anybody who may have questions about occupancy should feel free to contact the State Department of Fire Marshal or our local fire department, who can give you information about occupancy limits. The State Fire Marshal's website is opensafely.la.gov. Texas testing has been increased significantly in the state, and contact tracing is also being implemented throughout the state. As reported last week, non-essential businesses open in Phase 1 are limited to 50% occupancy, but must maintain strict social distancing, and that should be reminded that the 50% includes both employees and customers. The following non-essential business should remain closed as we are still in Phase 2 of the recovery. They are amusement parks, splash pads, children's play centers, concerts and music halls, festivals and indoor play centers, water parks, arcades, fairs, and theme parks. Last week, the governor indicated that the state would be making courtesy visits to establishments or gatherings where it appears people were not following the mitigation and prevention guidelines, and that punitive action would not be taken at that point. It was just a courtesy visit. However, with a recent downturn or increase in the number of positive cases, the governor has indicated that there would be robust enforcement against violators. He indicated yesterday that the current trend was not good due to the increase in positive test results and the increase in patients having to go to the hospital. He said we've had 3 weeks of going in the wrong direction, and it is serious and getting worse. He also indicated that the state would do a deep dive into data in the hopes to see a reversal of this unsatisfactory trend, but it did not appear likely unless we all do our part in this mitigation and prevention. The governor simply suggests business policy of no mask, no service. The governor also indicated that he would not be making a mandate at the state level with regards to wearing a mask, but he strongly recommends and urges us to voluntarily do so. And he also pointed out that some parish presidents down south and a couple of cities locally, Shreveport and Grambling, have instituted mandates to wear the mask. The governor has asked that we all be good neighbors. When you wear a mask, you're protecting those around you. When they wear a mask, they're protecting you. The governor stated that if voluntary mitigation proves to be insufficient, we will do whatever is necessary to avoid overwhelming hospital capacity. We will be dealing with this problem for quite some time, ladies and gentlemen, so let's be a part of the solution, not part of the problem. I strongly urge, as has the governor and others, that we maintain wearing a mask or facial covering, we maintain social distancing of 6 feet or more, and avoid congregating. I want to thank all of you in the parish who have joined us in this fight, in this community's fight against this pandemic event, and we will have our next briefing a week from today on Thursday, July the 16th. That concludes today's briefing. Thank you.